what are some other top causes of depression that functional medicine looks at?
So stress, hormones, infections, foods, and toxins, and really investigating on a deeper level all 5 areas. There are very well-known causes, even in the traditional world, that can cause depression. Things like hypothyroidism, B12 deficiency, folate deficiency, and that is looking at 5 areas. There's stress. Stress can absolutely, especially high stress, can shut down your ability to digest your food. So for example, neurotransmitters that your brain needs are made out of amino acids, and amino acids come from protein. The fats that you have in your food gets broken down and made into phospholipids, which is the bilayer of every neuron. Every nerve cell that is a phospholipid bilayer, which is made out of fat. 80% of your brain is fat, so you have to have healthy fats in your diet. So stress can shut down if you're in fight flight, which is, when you're threatened in some way, your digestion can shut down and not be able to assimilate those carbs, fats, and proteins. So all of these things, these foods, infections, toxins, and stress affect your hormones, particularly your stress hormone, cortisol. And cortisol is with inflammation, what goes up to be able to handle all of these issues is cortisol, which is your stress hormone. So stress doesn't necessarily have to be an emotional stress. It could be a physical or physiological stress, infection. So when a person has infections, and that could be parasites, believe it or not. So a lot of times irritable bowel syndrome, which comes with anxiety and even depression, is usually a gut dysbiosis. It's actually the root cause is having this imbalance of good bacteria, bad bacteria causing these symptoms.
And is that what dysbiosis means?
Yeah.
For those of us who are new to this kind of lingo, it's an imbalance of the good bacteria and bad bacteria in your gut.
Yes.
Got it.
Yeah.
Okay.
So believe it or not, all food is contaminated on some level. And so we have saliva that decontaminates it, and then it gets to your stomach, which is another sterilizer. And then you have bile salts, which is like a detergent. So we have all these layers to sterilize our food. But again, if you're under stress and you're not releasing the acid and the bile salts, then you might not necessarily decontaminate it completely. And if that food is contaminated with some type of bacteria, then it can colonize your gut and make it your home. It's home. So one area is food. So food is medicine, but it can also be poison. So well-known poisons are alcohol, which is part of our food industry, so to speak. But other things and people usually know that sugar is very poisonous and causes a great deal of inflammation to a person. And so those are the top 2 right there. But there are lots of other foods that can cause inflammation in the body. And especially if you have food intolerances or food sensitivities or food allergies. So, but even so, there are some categories of food that can be quite inflammatory for some people, like grains, as a category. So, and most people are deficient in certain foods that are very healing, like vegetables. There's a reason, is because these vegetables, not only are they healing, they provide all the nutrients to have all of your cells function properly. You need all the vitamins that are in those foods that you're not going to find in processed foods. And I mean, some processed foods are fortified, but they're fortified with synthetic vitamins. So that's one category. Yeah, believe it or not, your body can manufacture many vitamins, but it can't manufacture vitamin C. It's one of those vitamins your body actually cannot make. And so then there's the T in shift. So the T is for toxins. And so toxins it's sort of like, if you have ever been in like a dust storm with your car, driving through a dust storm, you have these filters in your car to be able to filter the air and filter the oil. We have filters in our dryer to, if you put something too much in the dryer, it's caked with all of this stuff, right? Right. And so believe it or not, we have similar filters, but we can't pull them out to clean them, right? We can't pull them out to clean them. But what we can do is avoid these toxins, and we're completely surrounded by toxins. We put toxins in our body, like alcohol, and we smoke cigarettes. Some of us smoke cigarettes. There's drugs, there's medications that can be toxic to our liver and kidney and other organs, even the brain. And then we breathe them in. There's air fresheners, synthetic perfumes. There's all sorts of chemicals that we breathe in. There's VOCs in wallpaper and paint, in our furniture, our mattresses, our rugs. And believe it or not, it's an assault to our bodies. And so our bodies, and plus, I forgot, makeup, right? Cosmetics, all the cosmetics and deodorant. So it's an assault to our body, and we're leaving it up to our certain organs to process and detoxify and eliminate those toxins. And sometimes it can be too much, especially if we're not eating foods that are healing and providing the vitamins. Your body, particularly your liver, needs certain vitamins to function properly and get those wheels turning to process those toxins. And so there's other factors as well that can prevent detoxification of these chemicals. But then if they don't get detoxified, or if they don't go through this process, it accumulates and can cause inflammation, particularly to our brain. So believe it or not, Parkinson's disease, one of the root causes is pesticides, exposure to pesticides.
Yeah.
Right?
Yeah. So sad. So sad. People think, and I know that a lot of that comes from people who were eating their veggies all along. It's just that they weren't eating organic, and they got a healthy dose of, pesticides along with those healthy vegetables. Okay. Got it.
Right. So you can't avoid everything, but you can be mindful of what it is that you're putting in your body, on your body, or breathing around you, and set it up so that you're breathing clean air, and putting non-toxic cosmetics on you. So really it is doing your homework and figuring out what you're being exposed to, and then helping your body to remove these toxins are really important.
Okay, I think I get a sense of what you're saying then. It sounds to me like what functional medicine does is it extends that evaluation that a conventional psychiatrist will do. It just makes it much, much broader, so that they're looking at a whole lot more possibilities, all the things you outlined in the SHIFT acronym as potential causes for the depression. Does that sound about right?
Yes.
Yeah, absolutely. Wow. Thank you so much for sharing all that with us. That's amazing.